Hi, so this is Kira Smith. I'm doing an example of an SBAR situation from a nurse to a doctor. So just calling up for a doctor to come down and evaluate a patient. So I'd say, hi, Dr. Stevens. This is RN Kira in room 1 at the AMU unit. I have patient Mr. C. He's 53 years old. PCA found me at 2100 hours after helping Mr. C off the bedpan. PCA had noticed a large black tarry stool and mentioned patient was complaining that he didn't feel well and his belly was hurting him. The background patient was brought by his wife by car to the ER and was admitted to AMU at 1600 on November 10th with syncope. His vitals read a blood pressure of 138/84, pulse 76 and regular, and respiratory rate of 16. His afibral at 98.6. His labs were normal. His IV infiltrated during transport, so the nurse started him on a new IV and put a warm compress on the site. Past medical history is that he was treated in the past for congestive heart failure and acute myocardial infarction. Patient is pretty healthy, no known allergies, and only takes NSAIDs at home for chronic back pain. Patient is pretty healthy, patient over 5.5 hours later, patient's blood pressure has dropped at 94/66, increased in pulse to 114 with an increased respiration rate of 24. His pulse ox was 97%. Patient appears pale in color and his skin was clammy. He does complain of abdominal pain 6 out of 10. So if the recommendation I would provide would be the patient has been given fluids, continue to monitor heart rate and blood pressure. The desired outcome is to control and stop bleeding, to return vitals signs to normal and receive normal blood counts and hemoglobin levels. So I guess so Mr. C needs to be seen by a physician now if you can come down and evaluate his condition. So the part on having like the hemoglobin levels and everything, that would just be asking if we do a blood count and asking for if we can go ahead and do those labs, but just letting him know what the recommendation is, and then have him evaluate and what to do from there. So that would be an example of situation, background, and recommendation for SBAR. Thank you.